walk us through how you got interested in this field.
Okay. I became interested early on by working at summer camps, long before I pursued my academic pursuits. And so I worked in what's known as residential summer camps for people and children with varying disabilities. I started that as a teenager. So I had
As a volunteer?
No, it was a paid position.
Oh, okay.
Camp counselor.
Camp counselor, gotcha.
Yeah, camp counselor. And that enabled me to literally live with and be responsible for the happiness and the well-being of people that I had never had the opportunity to have regular contact with. And that would be, children on the autism spectrum, that was adults with intellectual disabilities, cerebral palsy. And I just became very engaged, and I found that was my calling. And then I kind of geared my whole school journey to become a specialist in speech and language pathology and communication disorders. And it's been my life's work ever since, on all levels, working with families, consulting to schools, doing research, being in the Brown Medical School, and now being at the University of Rhode Island.
What does this consulting entail? When you say you're consulting with schools, what is that like?
Yeah. Typically I'm asked to come in and to observe a student or observe a class. I try to be a fly on the wall, following the kids in their regular routines. And then we pull together the child's team. Sometimes it's an adult's team. And we always have family members and parents come in. So we could always get together and brainstorm around the issues that might be of concern.
So you diagnose?
In the past, I did more diagnosis. Most kids I consult to now already have a diagnosis.
So it's more like management of, is condition the right term?
It's educational programming.
Okay.
And using strategies that may be thought of as treatment strategies, yes. Helping kids succeed in school, make friendships, and also helping the family and hopefully the students or the people I consult to have a better quality of life.
So we talked about how language and talking about, the language used in talking about neurodivergence has changed over the years. First of all, is the correct term condition? It's not a disease, obviously.
Yeah, we're not talking about a disease. We're talking about what's known as neurodevelopmental differences, that the brain is wired differently, the brain communicates to the body differently. The technical term, for example, for autism is autism spectrum disorder, but people are now saying, let's talk about condition, because disorder only focuses on the negative aspects. And what we're beginning to discover, whether it's autism, whether it's attention deficit hyperactivity disorder, ADHD, is that very often there are strengths and positive sides. So condition identifies the person as having, yes, some real challenges, but also some strengths that we could take advantage of.
Over disorder, which has that negative connotation.
Exactly.
So we talked about how you started in this field, what you do now. So how has the field changed over the years, right? Specifically, and you mentioned how we're getting more respectful of families and identity versus not using the person's identity. So walk us through how that's changing.
I would say the major overwhelming change is that people, both on the autism spectrum, people with ADHD, other conditions that are neurodevelopmental in nature, are now speaking up. They are taking the bull by the horns. They're taking the reins. And they are not only creating or suggesting changes in public policy and in laws, but also in the workplace, in schools. Up until the mid-1980s, we could only guess what the experience of autism was. Now there are thousands of autistic people who've written books, who speak, give lectures, and all of these people are teaching us what the experience of autism is, and also what has been helpful for them and what is not helpful for them. So much now is guided by the voices of autistic people.
Instead of people just talking about them over them.
Or guessing what their experience is like, yes.
So let's talk about your book, Uniquely Human. Walk us through what inspired it and what it focused on, what people can expect, essentially.
Yeah, in my book...
Without giving it away.
First of all, it's important to know it's a storybook, okay? I've done lots of publishing in technical journals and in so-called scholarly volumes for professional audiences. But I learned so much by telling stories about what I learn from autistic people and autistic children and also their families. So it's a book of stories, but I also fold in research. And I guess the real crux of the book is the title, Uniquely Human. Let's not look through, kind of the technical term is the lens of pathology. Let's not just look at the difficulties and the challenges that people on the spectrum have or people with ADHD. Let's look at them as human. We are all good at some things. We are all not so good at other things, okay? And we want to understand that sometimes when you see autistic people or people with ADHD, it's more extreme, okay? So they may be very good at some things, but really challenged at other things. Challenged to the extent that they're going to have difficulties in school, maybe in an employment setting if people don't know how to support them correctly. So Uniquely Human is really about trying to get people to respect that because we all have different neurological systems and different brains, that we think differently, okay? We process sensations, sounds, sights differently. We have different emotions. Some of us are rather kind of low-keyed and calm, and other people have much more higher anxiety. But if we recognize that that's something for all people, it helps us to support people who have more extreme challenges and even strengths in different ways.
Let's talk about how, now your new edition of Uniquely Human
Yes.
uses the terms autistic people instead of people with autism.
Yes.
So why make that change, and how has that discussion changed over time?
And that is one of the controversial issues. And that is autistic people, and the numbers are something like 70% based upon polls, prefer what's called identity-first language, that we should say autistic people or autistic child. It's also okay to say on the spectrum, okay, on the autism spectrum. And the reason for that is many people say it is such an essential part of who I am. It's not this disease or disorder or just this negative thing I carry around with me or burdens me. So probably the most famous person in the world, Temple Grandin, who's on the autism spectrum, says, if you take away my autism, you take away the very essence of who I am. And she was the first to say that. So the whole idea is respect all of me as a whole person, and a big part of me as a person is my autism. And then the other side of that is if we say person with autism, child with autism, it implies as if it's a disease or something that's just totally undesirable. Totally undesirable.
Or unnatural.
Or unnatural, as opposed to a part of my identity. And right now, there are so many autistic people who not only have written books, but who have podcasts, who have websites, who speak around the world. And they say, I talk about who I am as an autistic person. I don't talk about a person who has this undesirable condition or disease called autism.
So, from our conversations, you just mentioned the theater ensemble, you've mentioned you're consulting at local schools, you've mentioned organizations. It seems like there's a big community here in Rhode Island.
Yes.
Is there a bigger community compared to other states, or do the numbers kind of look the same regardless of what state we're in terms of how big the neurodivergence community is?
The numbers just keep increasing on a national level. The latest numbers from the CDC just went down to 1 out of 34 individuals are on the autism spectrum. As far as the community in Rhode Island, there's a wonderful parent-founded group called the Autism Project of Rhode Island. I work very closely with Community Autism Resources, which is just over the border in Massachusetts. I've worked with them for years. We've been doing a parent retreat with them for 25 years. So in this area, I think there's a greater density of resources as opposed to, I do have the opportunity to travel internationally and across the country, as opposed to a place like Wyoming or Montana. And in those cases, parents are sometimes desperate just to connect with other people as part of the community. So we're very lucky here in southern New England, in that if you want to connect to a community of parents and professionals and autistic people, you can do it here more easily, certainly than in more rural parts of the world, and certainly in non-Western countries, where they are way behind in terms of, awareness of autism, and certainly, in some countries, it's a loss of face to even say you have an autistic child. It's considered to be a black mark on the family. In some countries, kids who are autistic don't go to school, they're kept at home. So there are great variations, yeah.
So you said the numbers are increasing nationally.
Yes.
Do we know if the numbers are, like the rate is higher in Rhode Island compared to Massachusetts, Connecticut, et cetera? Or do we not have state-specific data?
That's a great question, and I'm not aware of whether there's updated state-specific data, but I believe the numbers are considered to be pretty much the same. Let me just make a few more comments about that, because again, it's one of the areas of controversy, and that is, are there more autistic people, maybe due to, who knows, conditions that we have? Some people have said exposure to toxic substances, all of this. Or is it that we're recognizing autism more, okay? And you have people on both sides of that issue. I think it's a little bit of both. I think there really is an increase in number, but I think to a large extent is the category of autism has expanded a little bit. But here's a clear example. Traditionally, it was thought the male to female ratio was 4 or 5 male to 1 female. And now, one of the most increased areas of diagnosis is women being diagnosed as adults, either self-diagnosed or diagnosed because they're going to somebody and they say, wait a second, I don't know what's going on. Some of these people have other diagnoses like ADHD. On this podcast that I do with Dave Finch, who's an autistic and audio engineer, of the 75 episodes, we've probably interviewed 50, 60 autistic people, and many of those were women. And many of them were late diagnosed women on the spectrum. So the feeling is that that ratio might be more like 2 to 1 male to female, or maybe even 1 to 1.
So we've mentioned quite a few different controversies, right, in terms of language and treatment, et cetera. What is the consensus, or is there even a consensus, of what is causing autism? What causes someone to have autism?
Yeah, and here, I think we have to say that it's not one thing, okay? So there are a number of different kind of issues in development. So for example, for many years, people thought premature birth was not associated with autism. And now, yes, the research says that in some cases, if a child is a very low birth weight premature child, there is a chance that that child might be diagnosed with autism. But of course, there are many premature children who do just fine, and it's no problem, okay? There has been a discussion about interactions, interactions between a genetic vulnerability, because we definitely see autism in general running more in families as opposed to families that do not have an autistic person. We see it much more in twins. So I'm not saying for every instance of autism, but certainly a certain subgroup of autistic people, there's a very strong genetic lineage that can be followed. It might skip generations, it might be a grandparent of a child, but it is not uncommon in my school consulting to be consulting on a child who's autistic, and one of the parents either is autistic and knows it, or says, I was pretty similar when I was a kid. Do you think I might be autistic? And in some cases, the answer is yes. And in some cases, maybe not so much. Okay, but certainly the genetics, but not just a genetic predisposition. People are talking about interactions between what's in us, okay, constitutionally, as opposed to, or I mean, in addition to, not as opposed to, in addition to, maybe exposure to alcoholism in a parent. People are talking about toxic substances in the environment. So it's still, I think most agreement is about the genetic piece, that definitely is a contributor. As to what else contributes right now, there's a lot of controversy about that.
I think the most controversial theory that you hear on the streets is vaccines and whether that influences or not the diagnosis.
Yes.
What has your research being done in the field say about that?
Yeah, the research, and not only from the U.S., but from a lot of other Western countries, especially Scandinavian countries, where they follow populations more closely, is that there is no relationship between childhood vaccinations and autism. Having said that, we do know that there's a very rare condition that's known as vaccine-injured children, which might end up with a child having a learning disability or cerebral palsy or maybe a diagnosis of autism. But what some people have tried to argue is that the great increase in numbers is due to vaccinations. There's absolutely no evidence of that.
Yeah, I think that's, I don't know what the history of that argument is, but it's something that we started hearing over the years, and it's become more common.
Yes.
I don't know what sparked that. It's a rumor at this point, right? Because it's not factual.
Yeah. A part of it is kind of the general, what people refer to as the anti-vax movement. That, we give far too many vaccinations to kids. And I think people are looking for arguments against that, and it also gets, down a rabbit hole that we really can't get into now, and that's like big pharma. Are they pushing vaccinations more? Whole other thing, yes.
Yeah.
Yeah.
All right, so I think we covered a lot of things. Is there anything I didn't bring up, anything I didn't ask that you want to add about your career, about the work you're doing here, about the work going on in Rhode Island as well?
Yeah, I think one thing from my work and my experience is that working with autistic people and their families is just an incredibly kind of, I hate the word rewarding, but rewarding, validating experience. I always like to say, and many parents say this, that we are much better people when we have autistic children, autistic people in our lives. That's not dismissing the challenges and the difficulties, but that many brothers and sisters of autistic siblings go into special education, speech-language pathology, occupational therapy. So it's a part of all of our lives, okay? And we could understand that sometimes we get back a lot more than we give. I've been doing this for 50 years, and every day's a revelation in my work. I mean, this is not hyperbolic at all. It's true. It really is true. So I think that's something that's important. The other part is community, is that especially people who are listening, who have autism in their family, seek out your community. It's important for autistic people to seek out their community, because autistic people that I know who are having the best quality of life are connected to the autism community, whether it's the parents or other autistic people. And again, in this area, there are so many resources and so many wonderful people. Just in the last week or two major organizations had their annual walk for autism. It's something that we need to do, and that's to take care of each other as human beings, but appreciate the differences and respect the differences in each one of us.